Good afternoon, everyone. My name is Alex Lamont, and I am a Legislative and Policy Coordinator for your New York State Association of Counties. On behalf of our President, Jack Marin, and our Executive Director, Stephen Aquario, I want to thank you all for joining us this afternoon. We've got a great virtual fall seminar session planned about using wastewater to slow the spread of COVID-19 in your county. Our 2020 virtual fall seminar is taking place through the end of September, and it includes nearly 20 workshops and meetings that are designed to bring the latest information on issues facing today's county leaders. We thank you for joining us as we move counties forward together, and we encourage you to use hashtag #CountiesForwardTogether to tweet about what you're hearing throughout the conference. This afternoon, we're here to talk about wastewater surveillance for COVID-19. From the beginning of the pandemic, there's been a series of setbacks in COVID-19 testing that have made it difficult to keep up with the virus's spread. Researchers at Syracuse University, SUNY ESF, and SUNY Upstate are now working with several of our counties and universities to implement a surveillance program that uses wastewater to measure how prevalent the virus is in a given community and estimate the transmission trends in real time. We'll learn today how monitoring coronavirus RNA in wastewater can guide your county through the process of safely reopening the economy and provide an early warning for a second wave. We're happy to be joined by a great panel of speakers today. The first speaker we'll have is Dr. David Larson, who is an associate professor for Syracuse University. He is an environmental epidemiologist with expertise in large data analysis, multi-level modeling, spatial analysis, geographic information systems, and study design. His content expertise lies broadly in global health with specific expertise in mosquito-borne illness, global health, and sanitation. We're also very happy to be joined by Lachlan Square, who is the Chief of Facilities and Safety for SUNY Oneonta. Mr. Square has been with SUNY Oneonta since 2017. He's responsible for facilities planning, facilities operation, energy management, construction, infrastructure, and campus safety, and environmental compliance programs. Prior to his service with SUNY Oneonta, Mr. Square held a number of positions in the higher education sector and had over 20 years of experience in higher education facilities planning, design, construction, and facilities operation. Finally, we're very happy to be joined by Rebecca Schultz, who is the Director of the Division of Community Health for Onondaga County. Rebecca is currently acting as the epidemiology lead for the department's COVID-19 response. In this role, she oversees data collection, analysis, interpretation, and reporting to inform policy decisions related to mitigating the impact of the pandemic in Onondaga County. During less pandemic-y times, Rebecca oversees the Division of Community Health, which implements a data-driven approach to influence policy and environmental changes at the community level to address inequalities and improve health. Before we dive into things, I'd like to take a moment to thank our sponsor, the LaBerge Group, for sponsoring this session. LaBerge Group has partnered with counties throughout New York State to provide engineering, architecture, planning, and surveying services to help clients capitalize on their most innovative and effective solutions to their greatest challenges. As a recognized leader in the areas of water, wastewater, and storm engineering, the firm has successfully partnered with New York counties on the planning and implementation of numerous projects within these disciplines. From water and wastewater infrastructure projects and grant development to countywide shared services initiatives and other government efficiency endeavors, LaBerge Group is committed to providing counties with practical and implementable solutions to deliver both cost savings and results. Now, at this time, I'd like to turn it over to our speakers. Thank you so much, David, Lachlan, and Rebecca for joining us. We'll start with David's presentation. Dr. Larson, whenever you're ready.
Thanks, Alex, and thanks for organizing this and having me. I'm excited to present to you some of our work we've been doing since March, really, of 2020. And the goal here, my primary goal has been to get my kids in school and address the pandemic in that regard. I got 4 little ones. And so the idea of wastewater surveillance is that as we collect data from the wastewater, we identify and analyze it for the pathogen. Then we can understand a little bit better what transmission is like in our communities and prompt early as well as targeted intervention. In the spring of 2020, as the coronavirus pandemic came through New York, what we saw was, devastating scenes of overwhelmed hospitals in New York City, and upstate New York basically shut down as a result. And we didn't see the same type of devastation, although we did have a number of deaths tragically from that. Well, I'll present some of what we see across upstate New York and the counties, and what I call the heterogeneity of transmission, such that for infectious disease, it's really a local phenomenon. My risk of contracting infectious disease really depends upon my community and then my own behavior, travel outside of that community. And so the risk of reimportation or people bringing the virus into our community matters, but on the bigger level, what's happening locally is the most important piece. Let's see. Next slide, please, Alex. Do I have control of the slides? Okay, so here's the layout. I'll go through, talk a little bit about the history, introduce the team. It's a big team. Go through the goals and the scaling and the early warning, as well as the transmission being under control as measures from wastewater, and next steps and some partners. All right, next slide. So broadly, wastewater surveillance is useful in a lot of different pathogens. It was wide scale used in the 1990s in sub-Saharan Africa and the Middle East in the fight against polio, right? And it's because you're able to take a sample that's independent of symptoms, it's independent of treatment-seeking behavior. With polio, you can actually catch outbreaks before they cause paralysis. And so for the polio virus, about 1 in 200 infections results in paralysis. So you can have these silent outbreaks there where nobody gets really all that sick and have it spread a lot before you see a number of cases of paralysis arise. And with wastewater, you can identify that, hey, polio just popped up in this community, and then you can rush in and vaccinate that community and actually prevent cases of paralysis and the problems that might cause later in life. And then beyond polio, more recently it's been used to monitor illicit drug use, microbial resistance, and a number of other pathogens. And so the idea here is that you pick up a sample from a treatment plant or even upstream from a pump station or outside of a residence hall, and then you take it to the lab and analyze it, and then that informs our public health decisions after that. All right, next slide, please, Alex. And so we sample sewage, we filter and concentrate that sewage, we test it for pathogens, and then we deploy interventions. And that's the basic process for wastewater surveillance. And next slide, please. There's a lot of benefits. And so one sample of wastewater represents the entire population that contributes to that wastewater. And so because everybody uses the toilet, that means that it's going to be representative of everybody that's in that community. And so that's nice. The wastewater data is completely anonymous. It's not identifiable in any capacity. And so there's human privacy is always preserved. And then it's independent of diagnostic testing of cases. So, and independent of symptoms. So for us to get tested for coronavirus, we first have to typically get symptomatic and then go seek a test. And some populations might not want to get tested because of the potential for quarantine. And then other populations don't ever develop symptoms with coronavirus. And so the wastewater just can cut through all of that to allow for a representative and unbiased estimate of transmission. And then it's cost effective. The most similar thing compared to wastewater would be to randomly select 400 or 500 people in a community and test them for coronavirus. And to do that on a twice or 3 times weekly basis is just cost prohibitive. That would be crazy amount of a crazy price. And so with the wastewater testing, for the price of a single sample analyzed, you get an entire community understanding of what's happening. All right, next slide, please. Up. So this is the team. You'll notice everybody on this team. There's like 25 people. So it's, even though I'm talking with you today, the Syracuse University team that I'm leading is broad and diverse from 3 different universities, numerous industrial partners, the State Department of Health, and working with some other partners I'll introduce later. So next slide, please. The goals of our team are to first give confidence that transmission is under control and social and economic engagement is safe. And really, like I mentioned in the spring, upstate New York, we responded to a pandemic that was occurring downstate. And so as that came through, you know, Onondaga County, Monroe County, Erie County, the larger population centers, anytime a new infectious disease comes through a population, it typically hits the large population centers first, and then also the wealthier population centers where people travel. And then it spreads out from there into the lower income folks who are actually at higher risk. And so with this varied transmission intensity, with a lack of understanding of where transmission was across New York, the entire state instituted a shutdown. Now for reopening, that shutdown, the reopening began to be more regional. Right? Governor Cuomo started with the western, central, downstate regions, all the regions of New York, and the region had to meet certain targets for reopening. But with wastewater, we can get even further. And so I'll show you data from different counties and the way that it could be used to really inform a specific county to say that, yes, let's keep going with our social economic engagement. It is safe or not. And the second piece of that is that when it does increase, the coronavirus, we have an early warning that it's increasing, an early indication of a possible second wave. Now that early indication of a spike can be followed up by a decline. And so I know Lachlan will talk about Oneonta's example. What we see in the city is that that spike was observed, but now the city is back to low levels, and it's continued, and it's been going down since that outbreak has been brought under control. And there's a huge amount of value in that. All right, next slide, please, Alex. And so our team, you know, we're working in about 14 different counties. We're just finishing up the state pilot with the New York State Department of Health, and that was to do some high intensity sampling in Buffalo, Albany, Onondaga, and Newburgh in Orange County. And then we're working independently with a number of other counties, and then we also have about 12 universities that are sending in, and more universities coming on. The state pilot is wrapping up. We have a presentation next week with the state health folks. We're trying to get presentations with the different county health departments to kind of go through the data, what we've learned. We're hoping to push the state to scale a statewide platform and then also expand regionally. The CDC is coordinating a regional surveillance or a national surveillance information portal for a platform for everybody, and then for the country. And then the Department of Health and Human Services just released a bid, an opening for a national platform that would just focus on the large population centers, treatment plants, about 100 of them. And so this thing is growing. I'd imagine by the end of the year, it should be pretty widespread across New York and across the country going forward. All right, next slide, please. And so the early warning that we see. So when we get a wastewater result, we detect the amount of SARS-2 RNA in that wastewater. And our limits of quantification are about 5 genome copies per milliliter of wastewater. And so if we get fewer copies than 5, then it's below that limit of quantification, but then we might detect it and we might not. And so when you look at whether it was detected or not, or quantifiable, we see clear correlation and separation between those levels in terms of the number of cases 5 to 9 days following that sample. And so down here at the bottom, when we don't detect wastewater or our SARS-2 RNA in the wastewater for a community, then we'd expect maybe 1 case per 10,000 on average, and it might go up. Now, if we do detect it, but it's not quantifiable, we'd expect about 2.5 cases, 3 cases per 10,000 with a little bit of variance. And then when it is quantifiable, then there's going to be a lot more than that. And this is the week after the wastewater was sampled for SARS-2 RNA. There is a lot of variance in this. There's a lot of variance in wastewater surveillance. And so we don't actually try to estimate the number of cases currently in the community or the number of people infected. The science just isn't there yet. And so what we do is we just look at trends. And go through that here shortly as present some of the trend models and where those are going. All right, next slide, please, Alex. All right, and so in terms of an early warning, we have good evidence now from 3 different SUNY campuses where we saw a spike in the community wastewater treatment plant before we saw a spike in the county level cases. And so Lachlan's going to present on Oneonta's case study, but also we saw this for Cortland and for Oswego. And so Cortland had largely non-detected coronavirus throughout the summer, a little bit of a jumped up to detected but not quantifiable in early August, and then back down to not detected. And then starting September 1st, they saw detection of coronavirus and then quantifiable levels, and they're still at quantifiable levels now. And that precedes where their county case data were in terms of the very low level of transmission. Then they had a little bit of a spike at the county, or at the campus, at SUNY Cortland campus. Right. In Oswego, we saw varying levels between non-detected and detected but not quantifiable before a spike in the wastewater treatment plant. And Oswego has 2 separate wastewater treatment plants, one on the west side of the river, one on the east side. And these are data from the west side. And so once you saw that spike, and then county cases came out a little bit later with the outbreak at SUNY Oswego. And then SUNY Oneonta in Otsego County, the wastewater preceded the county cases a little bit, and Lachlan will talk more about that and how he used wastewater to guide. And so here's some of the first evidence out of the platform for how well the wastewater surveillance predicts increases, and we're still working on a lot of modeling and a lot of data analysis, and hopefully, and by next week even, we'll have a better understanding of some of the trend models that we have. Next slide, please. Now, one of the cool aspects of our platform is that we're able to confirm that coronavirus is under control in the county or in the municipality. And so looking at Cayuga County and Auburn and Cortland County with the city of Cortland, every time we get a negative result or a non-detection of coronavirus in the wastewater, that gives us a probability that it's actually just under control, that things are all right. We can't necessarily say that it's not there, but we have a probability that it's not spreading. And with repeated negative results, right, and especially Cayuga County starting in mid-July, we started to get repeated negative results. And each time we get a repeated negative result, we increase the probability that coronavirus transmission is under control. And as this data is improved, a county executive or a mayor or a local health department could say, you know, we're 50% sure from the wastewater that there's not much, if any, transmission of SARS-2 in the community. And linking that with that early warning you get some very powerful public health messaging around that. You know, and as you go a month to 2 months of non-detection of coronavirus, it keeps increasing that probability. Now, the country of Australia has used this extensively to confirm that their outbreaks are under control, both in Queensland and Victoria. And I forget which one, either Melbourne or Sydney, one of their cities had a much larger outbreak than the other. But they were able to confirm that, yeah, we can't find coronavirus in the wastewater. We're not seeing the cases, and so we see it. We're confident that it's under control right now. Now, notice that Auburn has since had a detectable level, and so then that probability is gone. And so it's really the consistency in the negatives. And then with Cortland, you know, we had non-detection through June, most of July before it was detected again. And then again, it was, you know, non-detection before that's gone. So next slide, please. So our next steps are to provide a state dashboard that shows the alert and the threat level for different counties, and then even different sewer sheds within a county, and as well as another one that'll show it's under control. And this is an example of some data that are a few weeks old of the different counties in the platform, and the trend model for over the last 2 weeks, has the levels in wastewater been going up or been going down, right? And so we see some of these areas, this is Oneonta here, following the outbreak, it's been going down, right? Albany had a little bit of an increase. We were talking with the local health department there, and that was related to an outbreak among SUNY Albany kids. And then Oswego, the outbreak related to the Oswego campuses. Right. This is a dynamic situation though, so it changes every time we have a new wastewater sample, and then we can add the confidence that it is going up or going down with the darker shaded blue here being more confident and the lighter shaded blue being less confident. And so that's forthcoming. Hopefully next week we'll have that ready for public consumption. We just have to pass it through all our county partners first. All right, next slide, Alex, please. Right, and with that information, we can give more public health messaging, right? So the direction of transmission, is it increasing, is it decreasing, is it stable? The level of transmission, is it high, medium, and low? And then the risk of coronavirus, is it primarily within my community or is it outside my community? And all of these can help inform our behavior around responding to the coronavirus appropriately, right? The social distancing is such a challenging intervention that we don't want to be over aggressive with it, but it's such an important intervention that we want to have it ongoing while it's needed. And this can help us guide that quite well. All right, next slide, please, Alex. And so our partners, you know, we're very, very happy and proud to partner with the New York State Association of Counties. They've been fantastic in helping us get our message out there. We partner with the New York State Department of Health very closely, industry partners in Arcadis and Quadrant. It's a multi-university initiative with ESF Upstate and Syracuse University. And what doesn't fit on here, all the local health departments and all the local sanitation departments, the water environmental protection departments that we've partnered with, which has been fantastic so far. And next slide, Alex. And then I think the next one's just acknowledgements and thank yous. Yeah, so thank you. I can address any questions I think at the end, Alex, is that right? And then just a reminder that it's a big team. We've had some great funding from Syracuse University and the SUNY system, and then the New York State Department of Health as well.
Great, thank you so much, Dr. Larson. And that's correct. If you have any questions throughout the presentation, you can find a questions panel on your webinar dashboard on the side of your screen. We encourage you to type them in, and then when we finish our 3 presentations, we'll take the questions at the end. So thank you again so much, Dr. Larson. That was very informative. We'll move on to our next speaker now. Lachlan, if you're ready, we are ready for your presentation. Thank you.
If you could put up the slide that I sent, I'd appreciate that, the timeline slide, yes. So I'm going to speak briefly about, I'm not an epidemiologist, I'm just a facilities guy. I just wanted to talk about our experiences using wastewater testing from an operational perspective. As we've been developing our COVID safety plans for campus restart since earlier in the year, and as we were planning, we were interested we started planning in April and May, and we became interested in wastewater testing as a means of monitoring the whole population of the campus on a more frequent basis and more cost effectively than testing everyone. We have a fairly high residential population, over 2,100 students staying with us. And our plan included regular wastewater monitoring of the 3 outfall points from the campus, which captured the whole population, in combination with what we had planned would be randomized pool testing in our residence halls, just a combination of the two. So our plan was to start with wastewater testing and watch the levels of COVID. If we did see it start to appear in the wastewater, then that would initiate some of our randomized pool testing and perhaps point us in the right direction in terms of trying to find the asymptomatic students. And that's sort of that you've pretty seen the media of that in other states where colleges and universities have found 1 or 2 asymptomatic students through observing COVID in the wastewater. So you've probably been watching in the news. Our situation worked out to be a little different to that. And so what the timeline was is we started the wastewater testing at the end of July, and at first we saw a very low level hit on the 5th of August, but we had no students back at that point. And that was also an outfall point that was included academic buildings and various other buildings. And because we had no more detects after that point, we concluded that that may have been a visitor or a staff member. I mean, it was such a low level. So on the 17th of August, students started to return to campus, and we were paying particular attention to the wastewater results we were getting. And as they started to return to campus, we had no detect. And on 8/20, we had a result which was less than quantifiable, but it was detected. So as a result of that, we were able to start to mobilize our pool testing, our human testing in the residence halls. Of course, we didn't anticipate, I don't think we knew what was coming at us. So we were able to get organized with our first 500 pool tests to start to deploy. And on the 24th, we saw our first quantifiable wastewater sample, which was coming from an area which was a very large freshman residence hall, 380 students in it. And it wasn't a very high level, but it was a definite positive. And by that point, we were organized with our human testing. But as the positives started to roll in from 8/25, they started appearing off campus. There appeared to be more and more positives coming in our off-campus student population. On 8/26, we started to get on-campus positives. And then luckily we were able to get a great deal of assistance from Upstate Medical and SUNY in terms of pivoting and scaling up, because we were very concerned at that point about the rate that this was moving at. And we were able to get assistance from SUNY and Upstate Medical in terms of really scaling up our pool testing effort. And we started large mass testing on the 28th of August. And in about a week, we tested over 3,200 of the students. But the infection, at least the on-campus component of it, overall, we had a little less than 700 cases in the outbreak. But the infection, at least on campus, grew from one case on the 26th to 140 or 150 cases by the 31st. So that's a pretty rapid growth. What has been interesting, though, is to see things on the back end of the infection we're continuing to monitor. And in fact, I didn't mention, but as soon as we saw that low level, we increased the frequency of our sampling, and you can sort of see that on the scatter chart that I have up. But what's interesting is we're seeing this on the back end of the infection, and majority of our students have left us, they've gone home. We still have some students staying with us for various reasons, and there are also students that have been infected and recovered. So they've been cleared by the Department of Health, and they're staying with us. And what's interesting is you still see some COVID being shed, but it's clear that the intensity is really on the way down. So I can see the value of this in terms of that early detection. But for us, that early detection was a very low level. And luckily we were paying attention to that and started to get mobilized for pool testing. But I can also see the benefit on the back end, because we're testing all of our students once a week now, the ones that remain with us, as well as our faculty and staff that are on campus. But that, in combination with what we're seeing with the decreasing intensity on the wastewater on campus, gives us a lot more reassurance that the outbreak is ebbing. So that's really our experiences. I won't go into the logistical difficulties of dealing with 40, 50, 80 positive campuses, cases at a time. That's for another story. But I'm happy to answer questions at the end.
Thank you so much, Mr. Square. We really appreciate your presentation. Before we conclude, I'd like to turn it over to Rebecca. I'd also like to remind you that you can type in questions on the questions panel on your dashboard. You should find it under webcam on the side of your screen there. Now, without further ado, Rebecca, thank you so much for joining us today.
Thanks so much for having me. I really appreciate the opportunity. there's just such a great wealth of information about this tool, and we feel so lucky here in Onondaga County to have this kind of pioneering research going on right in our backyard. I think that Dr. Larson and Lachlan made a really compelling case for why this type of surveillance can be important for a university or college setting, or a population where you have sort of a defined population and also some resources to take public health action once you've identified a signal. Here at the local health department, we operate under very different conditions, very different parameters. When we're looking at sort of the general population, we're kind of limited in how we can react and influence the population's behaviors once these signals sort of pop up. I think it's a great opportunity to, if you have a community that has little to no active transmission, to start doing a surveillance system like this, to be able to either continue to prove that transmission is really low, or to be able to detect those first cases early enough so that public health action can be implemented. When we have a situation, though, where we already have a certain level of transmission in a community, it can be difficult from a population health standpoint to interpret what these positive results mean. We know that people are shedding RNA for a bit of time, possibly beyond their infectious period. So being able to figure out, does this truly mean there's an increase in incidence, or is this possible shedding from existing cases? Being able to sift through those types of questions and identify actionable public health interventions on a community level, I think is something that we're still struggling with a little bit, and we're really hopeful that we'll have some guidance either from the state health department or the CDC that can help local communities identify which steps are appropriate to take to mitigate spread of the virus at which levels of different thresholds. So we are excited about this as a potential tool, but feel like on the community level, there are still so many sort of confounding factors that we have to wade through before we can truly be confident that we could use a tool like this to help prevent the spread of coronavirus.
Thank you so much, Rebecca, and thank you again to David and Lachlan. Before we conclude, we'll take some time to answer some of the questions we've received from the audience watching the webinar today. The first few questions will go to Dr. Larson. The first is, how often should testing occur?
Yeah, that's a great question. So because we build on trends with these, right, and we have seen it in the communities where an increasing trend has given us an early warning. The tool is not yet ready for the real time, right? So we're just getting the real time stuff up and running. But retrospectively, we can go through and we can say, yeah, we saw early warning of an outbreak of increasing transmissions in the suburbs, in Onondaga County, as well as in other places. And then we can confirm with results now that it's decreasing or that it's still there. And so it is very much ready for the community level and for counties to use this. More information will be coming down from the CDC and down from the state health departments. And then depending on how engaged our team is with the counties, we can improve the interpretability of these data. So in terms of how often we should sample, at least twice weekly. Twice weekly is a minimum that I recommend. That gives you 3 or 4 data points over a week to build a trend line, and then even more data points over 2 weeks. And because of the variability within the sample, you really need to have that trend line, and the more data is better. If you can get up to 3 times weekly, that's good. But it's there's cost associated, and then there's also the process of pulling the sample. And so all those have to be balanced. But yeah, twice weekly is what I would recommend at least, and then up to 3 times weekly if you can.
Thank you. That's actually a good segue to our next question. What is the cost of this surveillance program?
So we partner with Quadrant Biosciences. They charge $300 per sample analyzed. And so for a community like that has a single, so I can point to Auburn. So for a community with a single wastewater treatment plant, to do it once weekly would be $300 a week, twice weekly, $600 a week. And the treatment plants are pulling samples all the time, right? They have numerous different regulations with the EPA and whatnot. So that's the cost there. To have help with the sampling, there's a number of different engineering firms. We partnered with Arcadis on the state health platform, and that's where the engineering firms can come in and help pull samples. They can help go upstream from the wastewater treatment plant to get better understanding within a city, especially large cities like Syracuse, Rochester, and Buffalo. You want to get upstream from that. So.
One more question for you, Dr. Larson, and then I have a question for both Rebecca and Lachlan. The next question, can testing be limited to a particular zip code?
Yeah, it can. When I think about a state surveillance platform, the ideal state surveillance platform to really have understandable, actionable data for the community, for local health departments, for the state health department. A sample from every zip code is kind of where I think about it. We've costed out that model. That would cost about $50 million per year for the entire state of New York. It seems like a lot, but with the coronavirus and how much is being used, to me it would be well spent. And the returns on the economic side to be able to show that here's a zip code without transmission, independent of test bias, independent of people seeking treatment, it has an example of an early warning. That's a really big value add. So you can get down to the zip code level. Mm-hmm. The more one caveat is the further upstream in the wastewater treatment plant you go, the higher variation you get with human toilet use behavior. And so that's where you need to be cognizant that there's variation in this, not only because people use different toilets when the need arises, but then also people might pick up coronavirus outside of their home zip code, right? So if we get a non-detection within a zip code, we suspect that there's not much transmission within that zip code or not many infections currently. That doesn't mean those people within that zip code would be completely safe from coronavirus. Their level of risk would depend largely on their neighbors and then the movement outside of their zip code that they take. And so those are some caveats there with the transmission.
Thank you. My next question is for Rebecca. At what point does the state and local health department, each one, we have these surveillance findings and they're presented to you?
I'm sorry, can you repeat that? You cut out really briefly.
So my question, at what point when we have these findings, does the state and local health department engage with this data? What is your role here in communicating it to the public or acting on the data to inform your public health response?
It's been really interesting. Since the beginning of this pandemic, epidemiologically, it's evolved in what we can now retrospectively say was a fairly predictable way. Our first cases were mostly travel related. Our next, sort of wave of cases were in individuals that were not able to stay home and hunker down during that sort of shutdown period, whether they were essential workers or just folks who economically weren't able to make that happen. Then after that, we started to see, specific pockets of populations being impacted geographically, followed by, the university population, and now we're seeing the K through 12 population. So it's been a really interesting sort of evolution of where we're seeing cases. We're pretty fortunate right now to be in a position where testing is widely available for individuals, and the turnaround times have been greatly improved compared to what we were seeing a little bit ago. So I think that, when we think about how to apply this on the community level, I think one of the reasons that it has been so successful in the college and university setting is because there are very well organized and well planned follow-up activities that happen. So if you start to see a significant increase in signal from a particular dorm or a particular area on campus, you can pretty quickly, and our local universities have done just this, you can pretty quickly gather people, test them, and isolate and quarantine in having the ability to do that quickly is wonderful, and that's what's helping to decrease the spread locally. But I think on the community level, it does get a little trickier. You don't have as much control, I guess, over the general population to recommend testing and to provide testing necessarily in somewhat of a resource constrained environment. So I think, if we have data that are showing particular zip codes maybe spiking with their wastewater, it can get a little challenging to try to message that to the public. Do you want to tell people in zip code A that they need to stay home now, but next door in zip code B, they're sort of free to continue moving around? I think that does become really challenging. But like I said, we are looking forward to helping to support a set of parameters and recommendations around, which thresholds at which we should implement certain public health actions. And I do think that that's coming, and I look forward to that.
And if I could jump in with some of the examples, the ways that other counties have responded with this data. We sat down with the Albany County Health Department and went through the maps showing the different transmission schemes. And they're able to target their mobile testing sites, and they're able to target some of their public health messaging to specific neighborhoods. And when you get the sense, as a public, we all have pandemic fatigue, right? We've been going through this thing for 6 months, pushing on 7 months now. And people are tired of it. And to get a reinforcement to say that, hey, you've had a spike in your wastewater in your neighborhood, be extra vigilant this week. And then, hey, it's come back down in your neighborhood. Like, really well done. Those types of geographically targeted interventions have been proven to work for numerous infectious diseases. And we're starting to see that with some of the counties engaging with the platform, with Albany, with Oneonta, with the village of Clinton, and even Oswego. With SUNY Oswego, the question is, well, the campus is on the west side of the river, contributing to that plant. And then you have the East treatment plant, and has it jumped over from campus, the outbreak, to the rest of the community? And to be able to say that, no, we actually don't see that in the wastewater, and the amount of comfort that can give to the public is really, in my opinion, invaluable in handling this pandemic. And so it's very much at the level of engagement with the data, depending upon resources available and whatnot, can really inform the public as well as the local health department where to message, where to stand up mobile testing, those types of things.
Thank you. Before I ask this next question that came in for Lachlan, this seems like a natural follow-up to the discussion we just had. What best practices have all of you on this panel learned in communicating the science to the public? And that question is for anybody who wants to take it.
I think from our perspective, the early warning, we did see the early warning, but I think paying attention to very low levels is important. I'm not an expert like Dave, but I'm glad that we paid attention to those first couple of tests that we saw before we started to see the whole mass of positives come in, because we were able to get organized with our pool testing. And the other benefit we actually got from this is it actually pointed us in the right direction, because we had tests on different outfall points. We were able to determine which of the residential precincts we needed to concentrate our pool testing on. So that actually gave us a little bit of direction and focus.
From my perspective, one of the big needs is to communicate what can and can't be done with these data in this system. Our program, as we've grown it, we focused on the science, and it's been acting as a retrospective analysis. And so we retrospectively look at and say, did we see that spike in cases? And with Oneonta, we were able to communicate that spike, and they were able to respond to it. But some of the stuff that we've seen in Onondaga, it's been all retrospective, going back and looking at, all right, did we see the increase in cases coming in Baldwinsville, which was recently seen in the schools, or within Brewerton? And as we get more into the real-time data and more coordination with the local health departments, that early warning will become even more pronounced, right? And so our challenge as a service here is to get the science communication to the point where somebody from the local health department, somebody from the mayor's office or the county executive's office can see a map of their county, can identify trouble spots that might appear later in the case, in terms of the cases, and to get planning, right? And then to communicate how much value there is in a negative result or in a result that, yeah, it's still low, that things are going well, and that reinforcement. So that's my perspective.
And I just really speak generally. I think that public messaging has been a challenge. The recommendations have changed so regularly that it's hard to keep up unless you're living and breathing this every day with what you're supposed to do to decrease transmission. So that's been tough. And from a local government perspective, it's been really important to share as much of our data as we can publicly. And be really transparent about what's happening in our community and make sure that the public at least feel comfortable that they have access to the information that they might need to make more personal decisions about their risk.
Thank you all for your very thoughtful responses. The next question we received is for Lachlan. The question is, where were the tests performed on campus? Were they on campus, off campus treatment plants? And then building on that, I think it would be helpful for this audience if you spoke a little bit about how this is working in practice. What partners are you working with logistically? How does this play out on the SUNY Oneonta campus?
This was, we bought 3 auto samplers, the ISCO auto samplers. They were a little expensive for us. That was an upfront cost because we don't traditionally do wastewater sampling. That's all done at our at the city's wastewater treatment plant. So we looked at our sewer system layout, and we looked for 3 outfall points that would enable us to monitor the whole population. And really, we just installed the sampling tubes inside the manholes where all that wastewater was going to running through, and we were taking a 24-hour composite at each of these locations. So it was at a very high level, and the strategy was really to just not be so much diagnostic as just monitoring the overall situation on campus. But as it happened, one of the sampling points happened to be have only 2 residence halls on it, and one of the residence halls was where the major center of the outbreak started. So that actually we could see elevated levels on that manhole and not on the other outfalls. So we knew that it was likely coming from that residence hall. But also we used it in conjunction. It's just one of the pieces of the toolkit. So we had PCR testing going on. We were getting results from rapid testing downtown. We had students coming into the health center with symptoms, and our health center was asking where they came, what was their residence hall. So we had a picture pretty early on of where things were starting. But that's it really.
Thank you. Our next question is for Dr. Larson. Can a dashboard be developed for each county so that they're able to show the public how the virus spreads?
Yeah, that's a great question. Right now, what we have is that state map. Then you can click on a county and see the different sewer sheds that are contributing samples. And so you would be able to look within a county to observe trends in transmission at the sewer shed level, right? And speaking about how valuable that is, I'll use a personal experience. I had a friend who's in quarantine right now, and I found out he was in quarantine on Sunday. We had his family over for dinner on Friday. So I'm going through kind of a light quarantine, right? And we're all doing the best we can with social distancing right now, but we all need to engage socially. And so we had their family over for dinner. But now that I know that he is a potential case, my behavior has completely changed. We're back to, lockdown mode, no friends. We're not going to keep this thing going in terms of the chain of transmission. And that's where I see that the wastewater could come in to say, we've had a spike in your neighborhood. Let's go back into our siege mentality with the coronavirus. But that's the goal, right? Dr. Mary Collins from ESF is leading the efforts on that, and she's just finishing up her tenure packet tomorrow, which is, if you know, it's just this giant, enormous document you have to do to make sure you have a job after this year. And then it'll hopefully be done by Friday is my hope. And then we'll start reaching out to the different partners to make sure that they're okay with having it be public access and everything. So good things to come, hopefully.
Excellent.
It is dependent on it's dependent on where you sample, right? So within a county, if you have, you know, we've been working with 6 different treatment plants in Onondaga, and so each of those could be identified on the map. If you're sampling upstream from that, then you can disaggregate into neighborhoods. So it's dependent on how many samples you're sending in a week.
This last question we received, I think, can be asked of the whole panel. What is on the horizon for the wastewater surveillance program? For you, Lachlan, on your campus, for you, Rebecca, you know, in your county, and Dr. Larson across the state and across the country, what is on the horizon for wastewater surveillance?
Who wants to start?
I think you're first, Lachlan.
We're going to continue monitoring. We're still monitoring our whole population twice weekly. We've consolidated our students into the remaining students into 3 residence halls. I think we're going to probably expand the program, and I think we'll build. There are cheaper options to the commercially available auto samplers, so I think we'll build some, and we'll start looking at more directed sampling towards individual residence halls. And I'm not sure how that will pan out, because you've got that whole variability in toilet behavior, but I could see us expanding the program somewhat as we move forward.
So I'll say, you know, as I mentioned, we are staying tuned. We're looking forward to having more results from this research, seeing how it's been validated in the community, and identifying the best way for it to be used for actionable public health interventions on more of a community level.
And then for us, we're pushing the state to fund this. Right now, the cost is borne on the counties or the universities themselves, and so we're pushing the state to fund a statewide platform. And then in general, there's a national, the CDC started the national surveillance platform, and they'll have a public dashboard by the end of the year, they thought. And so this is something that, you know, the state of Utah, Michigan, Ohio, Indiana have all started statewide wastewater surveillance. And it's such a useful tool to inform infectious disease response, that it's, you know, that we're talking, this technology is 30 years old, used in poliovirus for 30 years ago. And so going forward, what I expect to see is, you know, the entire country under some type of wastewater monitoring for coronavirus, perhaps mid next year. I come from the school of thought that the vaccine we have is not going to be widely distributed. We're not going to have a vaccinated population for another year to 2 years. And so when we think about living with this pandemic, we think about long-term engagement with the pandemic. How do we protect our vulnerable while still staying mentally sound and emotionally sound? And that's a give and take with social interactions, and it's a give and take with schools and everything. And that's where another piece of information in terms of what is transmission going in my community right now, we have the early warning, and that supplying that, giving that to the public, giving that to the local health departments is going to be invaluable. So I hope that the state will step in and fund this, and then as it grows regionally, as well as there's lots of parallel initiatives across the country at similar stages.
Thank you all. I think that is a great note to end this on as we get close to the 3 o'clock hour here. I want to thank everybody who's watching for attending this virtual fall seminar workshop and our other fall seminar workshops this month. Special thank you to all of our speakers, David, Lachlan, and Rebecca, for joining us this afternoon, and to our sponsor, the LaBerge Group, for sponsoring this session. You can find a recording of this webinar and a copy of the slide deck, as well as the recordings and slide decks of other NYSAC Fall Seminar webinars on our website. They're at nysac.org/fall seminar. And we hope to see you at our next NYSAC Fall Seminar workshop about the rapidly evolving landscape of COVID-19 testing. That'll be tomorrow at noon. Thank you all so much. Take care.
Thank you, Alex.
Thank you.